The dangers and consequences of vaping are growing as more research is conducted, and the sudden death of a Berks County man late last year led a local forensic pathologist to list one of the causes of death as vaping. Action News investigative reporter Chad Pradelli sat down exclusively with the doctor and the victim's mother to discuss this unusual case.
Determining a cause of death from vaping is somewhat rare and usually involves severe respiratory illness, but not in this case. Simply put, it appears the 34-year-old died of a heart attack, and the cause? Nicotine intoxication.
Went to bed on a Wednesday night and didn't wake up.
The sudden death of Danny Clark in December is still raw for Mom Cindy. Initially, the family had no answers.
And all they could tell me at that time was that they had done a quick toxicology and didn't see anything wrong. We had to wait.
It was a puzzle. Our first toxicology studies didn't tell us much. This one was very interesting.
Dr. Neil Hoffman is a forensic pathologist for the Berks County Coroner's Office. He says Clark had no drugs and only limited amount of alcohol in his system.
He had been out with his girlfriend and friends and appeared to be drunk. He had slurred speech. His coordination was off. He felt sick to his stomach, although there was not any excessive drinking.
Upon learning Danny vaped and his symptoms the night before his death, Dr. Hoffman wanted to dig further and ordered testing of his nicotine levels.
I got the result back of the nicotine level, and I said this was high, probably twice to 3 times what a normal heavy cigarette user would have.
He says Danny Clark died from arrhythmia caused by vaping. It was a startling finding for Dr. Hoffman, who's been a pathologist for 5 decades.
It's my first. I've never seen anything exactly like it.
He was doing a lot of vaping.
Clark says her son had been a pack-a-day smoker. He'd been vaping a year to try and quit, but there was one very important issue. He was vaping a 50-milligram pen, extremely high levels of nicotine. Most pens range from 3 to 20 milligrams.
He was vaping every 10 minutes. He was also using large amounts in each vaping container.
It continues to be an emerging public health crisis.
Dr. Robert Bassett of the Poison Control Center at Children's Hospital of Philadelphia says nicotine poisoning reports are up 21% since 2021, with 436 reports last year, 3/4 of which involved children younger than 6. In New Jersey, reports are up 35% during that time, with e-cigarette poisonings up 270%.
These liquid concentrations are increasingly dangerous because of the super high concentration.
Even if there is one person that stops, one person that gets a better understanding, I think that it honors Danny.
Dr. Bassett says his office only gets calls in extreme cases, so his numbers only reflect a fraction of the problem. And currently, doctors don't know what's a lethal dose of nicotine. But vapors beware, especially if using high-dose pens. I'm investigative reporter Chad Pradelli, Channel 6 Action News.